Well, good evening, everybody, and welcome to tonight's webinar on reproductive failure in the beef herd, causes, effects, and when to intervene. I'm Ellen Crane. I'm the Extension Coordinator with the Beef Cattle Research Council, and I'll be your moderator for tonight. This session will last for approximately 1 hour, but may go longer depending on the number of questions that you have for us during the question and answer period. If you're on Twitter, you can follow along with us using the hashtag BeefWebinar. We are recording this session tonight, and I will email out the link of the recording to everyone that has registered in the next day or so. If you miss hearing anything tonight or you want to watch it again later, you can do so. Of course, you'll be able to hear and see tonight's presenters, but we can't hear or see you. If you want to communicate with us, type into the small chat window on the control panel. If you have a question or comment for me or any of the presenters, that's the place to do so. And feel free to send any questions in at any time. We'll answer all of your questions at the end of the hour. If your internet connection is a bit slow tonight, it might help to close other programs that are using your internet connection. You may also want to close the webcam window, which means you won't see us, but hopefully the presentation will come through a bit more clearly for you. So with that, let's get started. This is what we will be covering tonight. You're going to hear from 3 speakers on this webinar this evening. They will be talking about real reproductive failure scenarios, and then we will open it up for the Q&A. So with that, we'll move into our first speaker. Our first speaker is Dr. Blake Balog. Dr. Balog has been working with beef and dairy cattle herds in the Brooks area as a veterinarian for the last 8 years. His areas of focus involve cow and reproductive management, ranging from nutrition, timed AI protocols, investigation into poor fertility, vaccination and health protocols, and bull management and soundness evaluation. He is a proud husband and father of a daughter and son. And Dr. Balog is a veterinarian and owner of Bow Valley Livestock Health in Brooks, Alberta. Tonight, Dr. Balog will be speaking about what it means to have a reproductive failure in your beef herd, and also a scenario where he dealt with a reproductive failure. So with that, I'll hand it over to you, Blake.
Lovely. Thank you very much. Thanks for that, Ellen. And I must say I'm super excited to present here today. This is sort of the closest thing to a producer meeting that I can get at this point in time, given our current situation. And I did a quick little bruise through some of the people that were coming in, and I did fortunately get to see some clients. So hi to those people that are clients, and thanks, Ellen, for the introduction to everyone else that might not know me. So here we go. We don't have much time, and so I'm going to dive right in. And hopefully, my first couple of slides, I kind of want to set everyone up in a sense as to, if we're going to talk about reproductive failure, I think we need to understand what is success to begin with, right? And so this is sort of how I would sort of term what success is. And so a lot of people might think that, okay, I got greater than 90%, that might mean success. And I think, if you say that, yeah, I got a 95%, preg rate or only 5% open on my preg check, that's fantastic. But to me, that doesn't mean a whole heck of a lot if I haven't defined how long that breeding season is, because if you got a 6-month breeding season, I still don't think that's all that fantastic. And then what's your calving distribution? So how many critters calve in the first, second, third cycle? And so these are the metrics that I think would define success. So breeding season length on your cows should probably be in the ballpark of about 60 days or roughly 3 cycles. Heifers, 45 days. We've got a lot of clients even around here doing anywhere down to 20 or 30 days, just pushing that reproductive momentum a little bit harder yet and selecting for the most fertile heifers. And then that calving distribution should be around 60 to 70% the calving in the first cycle and about 85% in the first 2 cycles thereafter. And so that with that, we've got normally fertile bulls and cows and heifers. We should see a 95% preg check on a 60-day exposure, 85% on a 45-day exposure. So just think of those when you're thinking about, how to define success and when you want to take a look at your own herd as to how you're doing, right? And use that in some of the case scenarios. And so this is why I think maybe this is really important, because both of these herds, you can look at them and they've got sort of similar percentage of open, but we can see with this group on herd 1 here, we've got 60% on the first cycle here, whereas, and total of 84% in the first 2 cycles, whereas this herd's trickling out all the way into 4 cycles, only 70% in the first 2 cycles. And I just did a little case scenario. This was sort of based off of 2 years ago numbers. But if we looked at the metrics on these 2 herds in terms of profitability, the herd 1 that had the better calving distribution had about a $75 per head of critters exposed advantage of having a better calving distribution. So there's dollars and cents as to having this this better reproductive momentum. And I think it's also important not only to look directly at the whole herd and what the reproductive momentum is and what the calving distribution is, but I think we should break that down into various groups. And I would typically want to break that down into our heifers, our coming second calvers, and our cows, right? So we can nail down when there's particular problems. And so with that, sort of knowing those things, just have a couple of examples I wanted to walk through. And before I guess I do this, some of the clients might know this is sort of how we like to capture some of our preg check information, as we use a form or a spreadsheet that we like to capture everything on. And in this form, we capture a few things. So we get the producer information, we get their exposure data in terms of their bull in, bull out time frame, days exposed, and then we've got this little breakdown here. And this helps us as the veterinarian doing the preg check to be able to sort of know what stage of pregnancy can we lump them into for first, second, and third cycle, because we like to stage a lot of our pregnancies when possible. We get some vaccine dewormer history in there, body condition score sort of breakdown, and then look at that pregnancy distribution, and then the overall sort of preg data. And we're going to look at an example of that with this group. And so I'll kind of walk you through what we see here. And so in this group, this was a group that had a bull in date June 10th, bull out on September 7th, which coincidentally, that was the same day that we were actually out preg checking. And so so it's true that at this preg check, there's probably some of those critters that, there's 0 days bred, right? The bull might have bred them that day and I wouldn't be able to see, but truly probably I could see probably around the 30-day bred critters up to the 90-day. And so we probably have about a 60-day breeding season that I should be able to see on my preg check in that group. And I guess other things to note is that we did 32 heads, so just a small group of replacement heifers is what it is. We ended up having 7 opens, only 78% pregnant. And I think sort of down here is sort of the key thing to see is our calving distribution. We've only got 20% in that first cycle and not even 50 in the second cycle even, right? So something's happened here where we don't have critters bred in the first cycle. And I think some important things as part of our history to ask about our producers too, as well as, what's vaccine history? And well, this producer had given a vaccine, but his timing was maybe off. And so he gave his vaccine. This ended up actually being the first dose of a modified live vaccine that these critters had ever seen before, was given 9 days before the bull went in. Well, unfortunately, there's a bad effect that can happen with giving a modified live vaccine to naive critters. And that it ends up I usually tell producers it sort of acts like giving them a dose of estromate, right? It sort of slows them off in a sense. But technically what really happens is a necrotic oophorytis. So the ovary gets inflamed and it might, definitely and for sure kill off any CLs or structures that are there to help maintain that pregnancy and affect fertility for a period of time. And it might have some other effects on them, including reducing AMH, which is a hormone that's released and can be important in sort of recruiting follicles. So in this situation, pretty sad scenario that this was actually fertility that was induced by the producer themselves. Interestingly, we had not sold them this vaccine. We only usually do the preg check for this producer, but we had advised him of how to set those critters up a little bit differently going into the future. And so that's something I wanted to touch on just briefly was vaccination strategies in general. And there's no way that I can go through in the 15, 20 minutes that I have sort of, the ideal vaccine program for every herd, because I think it comes down to a few things. What's your risk? So what do you know, what or who you're exposed to? Are you in a community pasture? Or are you buying high risk cattle? Are you exposed to some neighbors that do some risky behaviors? I think you need to be cognizant of what sort of product label claim you've got and what the efficacy of that product is. Pretty basic things you should be paying attention to is that any product you're using for fetal wastage and trying to prevent any issues should be a an FP product, so have fetal protection. And something that a lot of producers maybe don't know is they might be using a VL5 product in the fall time, so a Vibrio Lepto product in the fall. Just know that that only has, most of the products, at least the ones that have that multi-combo, only have a 3-month duration of immunity. So you might not be getting the same coverage as you might be expecting by giving that product too late in the fall. And then also know what your labor and infrastructure capabilities are, right? Because that all dictates sort of what program is going to work best for you. And like I say, there's no one program that I can tell you tonight that is the best, but sort of generally speaking, I do feel that sort of a blanket standard is that a breeding female should see 3 modified lives in their life before they get pregnant or exposed to a bull, and that should be roughly around a branding time, weaning time, and then pre-breeding. And that pre-breeding time frame should be as per the label of that product, and most of those are a minimum of 30 days pre-breeding. And so just pay attention to that. Work with your veterinarian to set up a program that's going to make sense for your herd, your risk, and make that a wise choice so you don't set yourself up for failure. And knowing that too, as well as herds that do routinely vaccinate, do for sure see improved fertility as long as they're using those products appropriately. So another example is just looking a little bit deeper at what our calving distribution is and what it can tell us about an operation. So in this example here, maybe nothing that's really extravagant in terms of the bull in, bull out dates necessarily, but about a 60-day exposure on this group. And we could stage those pregnancy a little bit bigger of a group. So we did about 400 head here in this group. Sort of important things to look at is that we had kind of a low normal, if you will, sort of total preg rate. But sort of the important things to drill down on is that our heifers did so. First calvers, the preg rate on them at least was not too bad. Cows was a bit lower, and so that's where I think it's really important to break things down in terms of what that calving distribution is. Looks like our heifers were set up quite well, and they actually had 60% in that first cycle. Our first calvers, though, we see they're starting to slip off a bit here. We only see 56% in the first cycle, and that's trickling down into our cows. And some other important things I think that we note with this group too, as well as our body condition score. And so we break this down into the opens versus the pregnant, and we can see that our opens actually were notably thinner. So maybe that had something to do with the fact that maybe some nutrition is to play. But we can also see that broken down into these 3 different groups here too, is that the heifers seem to be in good body condition score. Our first calvers are a bit slighter, so they're lower than a 3 body condition score. And they're definitely lower than what our cows are overall here too. No real trend necessarily in our by calving distribution by cycle here, but I think the big one is noting that we've got a trend of calving distribution here sort of getting worse with time, and we've got some issues with body condition score. And maybe not anything in specific that we have to drill down with these producers that is to blame, that it's nothing really obvious all the time is what I should say. But there's a lot of questions that come to mind, right? And so there's quite a few, right? So it gets me asking, a little bit more about, why is that body condition score lower? What was the nutrition of those critters? How was it provided? What's water quality? What was the bull power sort of situation for each of those groups of critters that might have been exposed for the heifers, first calvers, and cows? And what's heifer development like? What are we doing there? What are their body weights and that type of thing? What's their vaccination history and biosecurity? Were any new animals brought in? What's the genetics of those critters? And so just to talk a little bit more about, I guess, sort of what the physiological limits are and what we can expect for fertility out of some critters. And this sort of explains why I mentioned that in the first cycle, we expect to see 60-70% conception, because when you mate a perfectly fertile bull that passes a breeding soundness evaluation and a perfectly fertile cow, you only can expect 60 or 70% are going to conceive in that mating, right? And there's just a certain number of embryos that end up dying off, or sperm that just don't end up making it there. And so 60-70% of the time, we get a pregnancy that actually catches. And of course, there's situations where, guys get better catch rates than that, even get better AI rates than that. But normally speaking, that's for the average we want to work with. And the other limits that I think are important to when we're wanting to drill down into issues is knowing what the postpartum interval is sort of on average. And so for a cow, it's about 50 to 80 days, and heifer 80 to 100 days. And what that time frame is how long does it take from that critter when they calve to when they're going to be cleaned up and able to conceive again. Like I say, in a cow, that's anywhere down to sort of on an average about 60 days, and on a heifer, that's a bit longer, right? And so I think if we've done something wrong on those heifers, like dropped in our body condition score, that's going to delay that time frame that they're going to get back cycling again. And that also just brings to mind that, geez, should we be doing something with those heifers so maybe they calve a little bit earlier than the cows that we know that we've got enough time to catch them back up. So we need to be paying a lot of attention to our heifers, right? Because that's where our momentum starts. And so I think that means, developing our heifers to an adequate weight. So that usually means somewhere in the range of 55 to 60%. And then making sure they're calving out at a reasonable weight too as well. And we want to have them really at sort of optimal weight, not too heavy either, because I think we see more calving issues when we get critters a little too fat or too thin, as opposed to having sort of in that optimum weight. Other things to pay attention to when we're seeing issues with poor fertility rates is what's plane of nutrition. And we really want to see critters that are going to be cycling well, being in an inclining plane of nutrition or on a maintaining plane of nutrition. So critters that are actually inclining and plane of nutrition have better pregnancy rates than those that are either decreasing, or fat cows getting skinny too as well, is always a concern too. So we want to see them kind of in that 2.5, 3 body condition score, generally in either increasing or maintaining, and that's going to be sort of optimum for our cows and our first calvers. And this is just another example down here where we can see some issues with calving distribution and why it's important to be taking care of and monitoring our body condition score. So factors that sort of mess up with that postpartum interval and delay the time from when they calve to when they're going to cycle again, is being in thin body condition score, that plane of nutrition, and having some sort of dystocia. So really important things to pay attention to. And so why we should breed those heifers early, I think it just adds another layer of selection pressure on fertility. It just irks me when guys, they get a higher open rate, and then the next year they figure they just want to put the bull out for longer, and that's really not the solution at all. The solution is putting better selection pressure on fertility in that herd and paying attention to all these factors that we talked about in terms of plane of nutrition and nutrition in general. The other reason why we breed heifers earlier is that longer postpartum interval for them, so it just gives them a little bit more time to clean up. And then it also just gives you some more opportunity for those first calf heifers to just put more weight onto those calves too as well. So really, in summary, momentum, I usually preach, sort of starts in the womb with the fetus, and that comes a big part is to do with nutrition. And we don't have enough time to talk about it, but a big part of something that I like to talk about our producers is fetal programming, how nutrition impacts the expression of genetics of that fetus while it's in the womb. And so I think that's really important, and it also just is really important on those live critters that you're developing and that cow herd that you're maintaining too as well. So I think I've, with that, probably chewed up all of my time I've got.
Excellent. Thank you, Blake. If you have any questions for Blake, you can type those into the Q&A box or into the chat, and we will answer those at the end of the hour. Okay. So our next speaker will be Dr. Swackhammer. Dr. Rob Swackhammer provides bovine and small ruminant services at the Upper Grand Veterinary Clinic in Guelph, Ontario. Rob grew up in the Guelph area working on beef and dairy farms. Rob graduated from the Ontario Veterinary College in 1996. After 12 years of clinical practice at the Ontario Veterinary College at OBC, Rob decided to take on a new challenge and opened Swackhammer Veterinary Services in Rockwood, Ontario. Dairy cattle lameness, dairy farm profitability, and reproduction are areas of special interest to Rob. Rob's early years working on his grandfather's beef farm were formative. This led to an interest in small farm animal agriculture. Rob lives on a farm with his wife and 2 kids, as well as a small beef herd. Tonight, Dr. Swackhammer will be speaking about an early experience that he had with reproductive failure in his own herd. So with that, I will hand it over to you, Rob.
Okay, I'm just gonna figure out how to start video and share screen. Okay. I am definitely a little bit of a newbie at these presentations, so I'm going to trust that Ellen's going to somehow get a message to me if you guys can't see what's happening, but otherwise.
It looks good.
Yeah, you're good? Okay, perfect. You spoiled my surprise, Ellen, but it's not a surprise, actually. I was going to try and be coy about it and tell you that I did get permission from this client to fully discuss this case with anybody and everybody listening. The part that I miss about presenting in person is now I'm not sure who I need to feel embarrassed around when I meet you guys. So anonymity has its benefits and its drawbacks. Okay, title of this, other than reproductive failure in my own herd, is a little bit tongue-in-cheek, but this is what happens when optimism meets reality in a Southern Ontario beef herd. Before I start on this presentation, given where we practice and in a relatively urban area, most of our beef farmers honestly are hobby farmers, and land prices has a big part to do with that, but the #1 cause of reproductive failure in our herd is the fact that bulls very rarely get semen evaluations done before putting out with the cows, and often preg check is a pretty bad day if that's the case, because these small herds tend to only have 1 bull. So if he's not working, preg checking is a bad day. Or next spring if they don't preg check when there's no calves. All right, that's an aside. Back to our case study. So I really appreciated Blake's presentation, and it was very, very detailed, very professional. This is more of just a discussion of more like what you'd hear in the coffee shop about a reproductive wreck. So we're going to talk about the case itself. We're going to outline things that went wrong. We're going to outline things that got fixed. We're going to talk about the lessons that got learned, and then a brief review of the disease that caused most of our headaches. Case study, a new farmer, yeah, somebody we know pretty well, acquired 10 cows from his grandfather. This was a bit of a stretch financially, so when a neighbor offered to rent out the other half of the barn and put some feedlot cattle in there, that seemed like a good idea at the time. These cattle that were brought over from his grandfather's herd were pregnant heifers. They were moved in about September. A couple months later, the feedlot cattle arrived to fill the other half of the barn. So despite being on the same premises, these were basically handled as 2 separate herds. Different feed, as you can imagine, different people looking after them, separate parts of the barn. They did, however, have access across an 8-foot gate, and but otherwise they were managed separately. Okay, problems begin a month after the feedlot cattle arrived, maybe a little less even. So we ended up seeing the first pregnant heifer getting very sick with a very high fever, terrible nasal discharge, and even though she did end up recovering from that illness, she aborted a fetus that we judged to be approximately 4 months of age. Sampling of the cow, sampling of the fetus revealed a diagnosis of IBR, or infectious bovine rhinotracheitis. January, the woes continue. 3 more heifers abort that month. Again, these these cattle weren't quite as sick. We did wonder if it was a different disease, took samples and showed that it was in fact bovine viral diarrhea, or BVD, that was the cause of these abortions. February, what should have been done a long time ago, finally got done. Kind of like shutting the barn door after the horses left, but the heifers did get vaccinated. A killed vaccine was used as protection from IBR, BVD, PI3, BRSV, and lepto, with the idea that there were some remaining pregnant animals in the group. In March, the vaccine got boosted, as the label would indicate was appropriate. We saw one more aborted calf. 2 more calves were born. This time they were alive, but were very weak and died a short time after birth. April, finally things are starting to turn the corner. We're feeling a little bit better. 3 healthy calves are born and things are looking good. In May, one of the calves gets sick and of course worried about what was the cause, but treated this calf hoping that it was just a neonatal diarrhea case, but that calf got very sick and despite extensive treatment did go on to die. Postmortem of that calf revealed it died of mucosal disease. We'll touch on that a bit at the end when we talk about the disease itself. In June, the 2 remaining calves out of the 10 were blood sampled and determined to be persistently infected with BVD. So this was a big goose egg in terms of the first year of owning cattle, and pretty devastating. Those 2 animals, those 2 calves were kept since there was nobody left pregnant. They were just housed with the heifers and sold direct to slaughter at weight. All right, let's talk about what went wrong. A little bit like this picture, there was a lot of optimism involved. I think that the owner of those cattle are pretty optimistic that cow's not going to step over those top 2 rails over the snowbank. The cattle in the herd, or the heifers that were brought in from the grandfather's farm, I mean, the optimistic viewpoint is they're healthy. Yeah, they're not vaccinated, but they'll be okay. In reality, it should have been obvious that these heifers had a very naive immune system, being that they were from a herd that had never been vaccinated. As Blake said, there is no such thing as a closed herd, and despite saying closed herd here, there was a bull that would come in every 4 years probably, and 2 to 4 years, and so that was the only animal that was entering the herd. So anyways, in fact, the reality is that those animals were susceptible to any disease that they were actually exposed to. Again, optimism. What went wrong? The optimistic part of this equation was the owner thinking extra income would play a part, helping pay some bills. In reality, it's what set off this time bomb. So those newly arrived, very stressed calves that were bought from mixed source auction were high risk and brought active infections of IBR and BVD, which they extremely effectively infected the heifers with, despite only having access to them across an 8-foot gate. I guess access is access. Question. You guys are all wondering, why would this idiot not vaccinate his heifers? I can say that since you know who the client is now. Why wouldn't these pregnant heifers have been vaccinated, on arrival or before the feedlot calves arrived? The question, or the answer to this question, is unbelievably simple, but also probably the most common reason for illness I see on hobby farms. The answer, it was just too hard to do. So this is something I've dreamed of having for a long time that we finally purchased just last year. We finally have a mobile chute that we can share with other hobby farmers now through our vet practice. But at the time, the only way to catch these animals would have literally been to lasso each of them and tie them to a beam that we hoped wouldn't pull the barn down, and incredibly labor intensive, and we did figure out how to do it, but when these cattle aren't the source of your primary source of your income, those kind of things definitely get put to the back burner, and this came to bite us in the rear. Okay, how did we fix this problem? There was no fixing it, honestly, but the way we carried forward was the infected calves were shipped before the bull was introduced. So we decided just to take a break on rebreeding any of these heifers, and they were vaccinated with an MLV virus vaccine, so modified live virus vaccine, at least a couple weeks before the bull's arrival. In reality, they probably had natural immunity to it already, but decided to practice what should have been done first. What lessons did I learn? So this case was unbelievably instrumental in both my practice and my farming career. Key take-home message from this episode was that a farm or a barn should be set up to make it easy to do the right thing. So managing by hope is not a good enough thing. You need to buy the infrastructure, you need to set it up to make sure that an animal is easy to catch, and that is honestly something that I really drill home to the guys, even if they only have 4, 5, 6 cows that they're buying as part of their hobby farm. Buy one less cow and buy a chute. You will be much happier in the long run, and you'll be able to do all the animal health procedures that should be done in a timely fashion. Number 2 thing we learned, you can hope for the best, but you better plan for the worst. So with this in mind, biosecurity was the big problem in this herd. And so biosecurity is paramount. There should be no contact and ideally no shared airspace for at least 3 weeks between resident and new animals. That allows the new animals to basically shed any viruses they may have picked up and create immunity. And I say new animals, but that could also be animals returning to the farm from being in contact with other animals. Number 3, what else did we learn? That no calves for a year and therefore no income is a real possibility with an inadequate or non-existent vaccination plan. Again, something that I drill home to our small farm beef producers. Again, not being the primary source of income, optimism often outweighs reality, but this was a good lesson that they can learn the easy way instead of the hard way. Prevention of BVD, protect your herd. So for herds with a tight calving window and therefore a decent amount of open time as an open cow, modified live vaccination programs probably are the best way to prevent losses from BVD. In reality, although it's a poor second best annual vaccination with a killed vaccine and an appropriate booster when needed is probably what's happening, but that's in reality not enough to prevent the formation of persistently infected calves or even abortion. It will reduce clinical BVD in the cow herd, but not as likely to protect the calves inside those cows. Prevent entry of the BVD virus, so ensure you got a solid vaccination program of both the animals that are already at the farm as well as the animals that are being purchased. Test any potential new animals for BVD before arrival at the farm, and a 3-week quarantine, minimum 3-week quarantine for new and returning animals. Okay, brief review. Just checking my clock. Looks like I've got a couple minutes left. We're gonna blast through these. This is stuff you can pick up on a bunch of different websites. I'm just gonna highlight some of the important points. So BVD is actually a very widespread disease, and surprisingly, most herds are actually still at risk of infection. Once the animal is exposed, the incubation period to clinical signs is about 3 to 5 days, at which time you're going to see some severe sickness, bloody diarrhea, high fever, off feed, mouth ulcers, pneumonia, and while many of the animals do die, they can recover, but it takes 1 to 2 weeks. Most of the animals infected end up being young, 6 to 24 months old. This nice little chart was lifted from farmhealthonline.com. And here we see both some clinical signs as well as some long-term effects. And apart from abortion, infertility, pneumonia, diarrhea, and mucosal disease, some of the things that are a little more long-lasting in the herd could be things like infertility, embryonic death, fetal loss and mummification, abortion, congenitally damaged calves, weak calves, persistently infected calves, which is actually really the biggest part of the problem with this disease, as well as some suppressed immunity in calves and adults. This slide probably illustrates the most important part in terms of reproductive problems with BVD virus. So that chart on the bottom is a nice little visual, again from that online source, which talks about what happens to BVD infected cows and the calves inside them. So BVD effectively crosses the placental barrier and infects the fetus, and depending on when that happens is what we're going to see in terms of the reproductive problems. So if it happens close to fertilization, you're going to have reduced conception rates, early embryonic death. Less than 4 months, you're going to see these formation of persistently infected calves, which is the biggest part of the problem. And then a bit older, you're going to see some congenital malformations. You will get some calves born totally normal and actually testing positive for antibodies to BVD virus. Quick overview of some of the things you're going to see, notably oral ulcers and the slobbering. On postmortem, some erosive lesions on the esophagus and hard palate. Cataract in young calves make me suspicious that there could be a BVD problem in that herd. I really wanted to spend a lot more time on this slide, but I see I am way over time already, so we're going to blast through it. The biggest problem with persistently infected cattle is that they shed large amounts of virus, and that continues the problem year after year because they are infecting the pregnant cows and creating new PI calves. The PI calf may look normal, but go on to die at less than 2 years of age. And very often we don't see lesions at necropsy. This mucosal disease that we talked about earlier is what happens when they get a superinfection of a different strain of BVD, modified live virus vaccine put into them, or the virus that's already in them mutates. We're going to just skip over this. It's just a visual of what we've already talked about. Vaccination, Blake touched on it. We've got modified live vaccines giving us better immunity, but in improperly vaccinated calves or heifers or cows, they may cause abortion and will kill PIs with mucosal disease. Killed vaccines are safe for pregnant animals, but have a short immunity and don't protect the calf. Maintain a closed herd if possible. Vaccinate with BVD 2 weeks prior to moving. Test for PIs before moving animals. When you're purchasing animals, when possible, move with your own track directly from the farm. Isolate all new arrivals for 3 weeks in a well-ventilated area away from the rest of the herd. So this also includes calves that are returning from fairs, etc. Testing, ongoing testing, if you've ever had a BVD break in the herd, is super important to find those persisting infected calves and get rid of them as soon as possible. Even in vaccinated animals, depending on the vaccination program, you may cause new PI calves. Oh, this is just a quick side note saying that this coronavirus has found that face masks actually are good for more than just preventing infection with coronavirus. I think I might wear one every year from now on for break checking. And there's the people that I need to thank for making it happen. And I'll turn it back to you, Ellen.
Perfect. Thank you so much, Rob. A lot of great points in your presentation there. If anyone has any questions for Rob, please drop those into the Q&A there on the screen, and we will get to those at the end of the hour. But our next speaker will be Dr. Martin Kaatz. Dr. Kaatz has been practicing as a veterinarian at the Lethbridge Animal Clinic for the past 5 years. Following graduation, Dr. Kaatz investigated the pathogenesis of BSE in cattle at the German Federal Research Institute for Animal Health. This experience facilitated a spot at the European Canadian Research Program to transfer BSE detection methods to find chronic wasting disease prion proteins. He moved to Canada shortly thereafter and became associated with the Lethbridge Animal Clinic in 2015. Tonight, Dr. Kaatz will be speaking about an operation that experienced high calf mortality and how they overcame this. So now I will hand it over to you, Martin.
Thank you very much. Thanks for the previous speakers and also all attendees. I will start sharing my screen now. There, is that all good?
Looks good.
Perfect. Okay, I will talk, and actually the sequence of our presentations fits right perfectly into what I want to describe now. It's a case study. It happened in southern Alberta, in operation, decades in family hands, about 150 cows, purebred Herefords, and some crossbred animals. Their calving windows March, April. Housing is how it's supposed to be. There is a heated barn, there's multiple corrals, pasture, calving sheds, and so on and so forth. Feed good quality hay through winter. We have mineral lick taps since the cows came off the pasture. Water is really good. There's some runoff water. There's also drinkers. Vaccine program, fairly standard. Pre-breeding, modified live vaccines, annual scour vaccines, regular pour-on dewormer. And despite calving in March, still every calf receives in-force within 24 hours after being born. There is no reported history of an unusual mortality or morbidity other than the little bit of scours, a little bit of beard as a respiratory disease in cows or calves. The only difference from this calving season was prior to the calving season we will talk about 100 cow calf pairs were purchased in April 2019. Those cows were bred back on pasture, 70 were sold, 30 remained in the herd. So the disease process, I would like to I have 3 different phases I want to guide you through. And our phase 1 starts with just calving season is on the way. Everything is going well until we discover some calves needed support, some needed to be hot box, fed colostrum. They were just sound a little bit off, a little bit weak. We paired them up again with a cow and watched the colostrum intake. When it was really lousy cold, some cow calf pairs, even multiple pairs, were stayed in the barn overnight. And with a fairly sudden onset, we had 6 calves, about 10 to 20 days old, showed following clinical symptoms. We had increased respiratory rate, very remarkable. Pale mucous membranes, they were lethargic, and a body temperature just above normal. So a very smart veterinarian, hopefully listening to us here right now, said that the common things are usually more common, and so our potential first diagnosis is, oh, maybe we have a little bit of pneumonia in them, maybe there is some deficiency in vitamin minerals, so we treated animals with Resfloid just out of the gate as soon as we found them. But to our surprise, one calf we just found dead. 2 animals, despite the Resfloid treatment, died, and those 3 animals died within hours from each other. We opened all 3 up, and all 3 of those calves showed absolutely identical necropsy findings. We have a severely enlarged congested liver, pulmonary edema, pale skeletal muscle on just by the looks of it, And two out of three of those calves had a very mild pneumonia. So I have some pictures. So the two pictures on the top are from two different animals, and I hope you can appreciate that, yeah, how identical it looks like. We have really the liver is just, I don't know, not quite twice the size, but definitely remarkably enlarged. We have, especially on the picture to the right, you can see the edema, the interlobular spaces of the lung are just filled with fluid. And yeah, the heart muscle, maybe a little bit on the pale side, so is the skeletal muscle on the hind leg. And our diagnosis after we just looked at that, we still could deal with some BRD, but then the next thing in my mind was vitamin E selenium deficiency. We treated other animals showing up with those signs with Resflo and injectable vitamin E selenium products. But just to confirm what we think it is, we sent fresh and fixed samples, lung, liver, kidney, heart, and skeletal muscle to a diagnostic laboratory in Saskatoon. And this is where, after those samples were sent off, I would now call our phase 2 in the disease process. It came back with vitamin E normal, vitamin A deficient, and one of those other minerals, somewhat deficient as too. The histology, and I have the report for someone who wants to quickly fly through this, but to make it short, there is just an excessive amount of white blood cells in basically every of our submitted samples, which basically indicates a severe inflammation. The lady who just wrote the report put down as her preliminary diagnosis a septicemia, and just because it fit the textbook really well, potentially salmonella. And you have to then now deal with, we send only one animal in, we just now think, oh yeah, vitamin A deficiency might be a problem. So treatment, we did the AST, which basically means which antibiotics those bugs are sensitive to. Triveterin was one of them. That we pulled this out of our sleeves before we had this AST finally done, and it came back that Draxin, or the 202-mycin, is sensitive to. We used this on our calves, and every calf basically got an injectable vitamin A product as well. So from now on, our phase 2 continues as we have multiple calves just still popping up. They receive vitamin E, selenium, and vitamin E injections within the first 24 hours. We started all sick calves with their moms were separated from healthy pairs. We put them in a different pen. Everything just basically not necessarily looked wrong, but symptomatic calves were treated with Draxin. And as some animals seemed to hang in there, some improved, others they died. So usually not many calves died untreated, but despite treatment, we still continue to lose animals. As further testing went on, a multi-resistant Salmonella Dublin was confirmed, and animals showing a variety of symptoms with this antimicrobial treatment often unrewarding. And as when we think Salmonella, and we also think just diarrhea, bloody diarrhea of some sort, we have not seen a single calf with diarrhea whatsoever. What we've seen, basically, we have lethargic, heavy breathing calves which either kind of make it or they die. And actually quite a few of them were neurologic. And I just have one calf here, and it is absolutely heartbreaker seeing those calves going down, being neurologic, and dying within hours after you just experience those things. Those calves were dead like a doornail. So phase 3 is now the tail end of the story, and it's like a completely ongoing process. And our survivors, we were quite happy to see some of them pulling through. A fair amount of animals developing significant arthritis with subsequent non-weight-bearing lamenesses. Some were just kind of poor doers, but those arthritises were fairly significant. And we still, even in this side where we had recovering animals, we still had new cases with the same outcome as described above. And I have two videos of the same animal. One was shot on April 23rd. And as we can see, he's a little crippled up, and he for sure did not want to move his leg very much. I see just riding to the sunset. And on May 8th, the animal seemed to be way perkier. I mean, the whole body seems to be just developed, and the posture is just completely different. Nevertheless, the animal is just refusing to use the leg. And so to finish the story on this animal, it just actually turned around and it overcame the arthritis and just grew actually to a decent sized calf. So this gets me to the conclusion. So what do we know out of this whole deal? So we know we had confirmed Salmonella Dublin, which is in a beef herd, somewhat fairly uncommon. We've seen this as fairly a devastating event in dairy herds, but so far this is the first time that I came across this in a beef herd. We lost about 30% of the calf crop, and this means really death loss. It does not mean sick and poor doing recovering animals. We had a few normal BRD cases. We did not have any diarrhea, no scours whatsoever in this herd. The calving barn, so what we do know, we for sure just disinfected and cleaned the calving barns and the sheds fairly thoroughly. So what we don't know is what's the source. I mean, we can talk about those purchased cows. The purchased cows, if they bring it in, usually Salmonella Dublin, as by the fact sheet, is that they abort more than they actually just give birth to basically shedding or sick calves. We had, because as many as those calves died, we had a couple of feedlot calves grafted on those cows, but they had a minimum of 8 weeks quarantine and were just fine. I read that potential source of Salmonella Dublin could be rodents, which, I mean, if you're in a farm environment, this is always a possibility, which could explain the onset of things after just basically being half through the calving season. The role of vitamin A deficiency is unknown. We know if with a deficiency you could have problems with your immunity. We don't really know what the long-term effect of the performance is. The chance of shedding, there is reports that in dairy barns that those calves can shed this for quite some time. But they are usually experience the diarrhea form. So calves with normal manure, do they actually shed this through this through feces? So that's kind of unknown. Subclinical cases maybe still lurking around. What I think is the difference between a dairy barn and a beef operation is that we definitely do not deal with a population density like the dairy barn does. And we will know next March what the chances of reoccurrence is on this. I want to now just basically finish my presentation. And as we know, the beef business or agriculture business in general can be really, really hard. And I want to end this on a positive note. That little critter you see on the picture there is the only animal ever in that herd got a name. We named him Klaus, and Klaus was the sickest calf you've ever seen who recovered. He was flat out, he was treated, he got up, he was as lame as it gets, And by the time it was time for pasture, Klaus said, thank you very much for taking care and never give up. And that's my closing remark, and thanks for listening.
Well, thank you for the positive note to finish that one, Martin. Okay, I'll share my screen. Okay. So hopefully we haven't given everyone calving nightmares for tonight. But if you have some questions for any of our presenters tonight, please type those into the question box or into the chat window. And I'll ask all of our presenters to turn your webcams and your microphones back on, and we will get to some of these questions. And there are lots of them. I see some of you were going back and forth on some of these already. Okay, this one says it's a question for Blake, but all three of you feel free to chime in on this one. The aim to have 95% or higher conception rate for your cows seems high to me. How is cull rate prior to exposing your cows to the bulls taken into consideration?
Yeah, good question. I guess I'll maybe answer two questions at the same rate there too as well, because there's one that's asked sort of what our practice sort of average is for preg rate, and I just looked back at 2019. I don't have the 2020 data, and not all of our producers do we record everything on, but at least on our 2019 people that we did, we were 91.7, so we didn't hit our target. So why do we not hit our target? I think of 95%. I think there's quite a few reasons. It's because every person's situation is unique, and I think there was I think it's a guy that's actually from the Western producer that asked a question here. Cameron Olson here asked a question that of sort of, you know, why are we not even hitting 85% sort of weaned calf sort of rate too as well? And I think it gets to be multifactorial, right? And we try to achieve that sort of best situation, and biology dictates that, you know, that's possible. But I think everyone's herd level dynamic sort of changes sort of things quite a bit, right? So whether that be, you know, you've got genetics that are beyond what your environment can provide for, or you've got something down with bull to cow ratio, or you've got something with nutrition or whatever it may be. It sometimes is hard to achieve that, but we definitely have herds that do achieve that, right? And so definitely in any of our producers, they come down to being on a bell-shaped curve, right? And so there's some that are going to achieve that, are all going to achieve that? No, but we'd hope that, you know, our top 20% that probably should be able to hit 95%. So on average, yeah, we end up being below that for various reasons. So a very gray zone answer. I apologize, because there's lots of reasons to why we don't.
Okay, Dr. Kaatz, did the farm buy any dairy calves to put on the cows that lost their calves? Could the Salmonella Dublin have come from these calves, if so?
No dairy calves ever entered the farm. It's a good question, because that would definitely explain things. There were only 2 feedlot calves not entered or just basically put on cows, but they were quarantined lengthily before they just made the trip out there.
Okay, another question. So my understanding, right, that if you vaccinate early for BVD, you can still have transiently infected cows that would result in persistently infected calves.
Yeah, I'll answer that since it probably has to do with my presentation. Yeah, yearly vaccination will help, but depending some risk factors of animals coming and going to your farm, as well as what type of vaccination program you have. So I could see a situation where you were using an annual killed vaccine and having some animal movement, either animals from your farm going to fairs and coming back with possible exposure to BVD, or buying animals in that had been exposed to BVD. They could shed that virus and infect a cow who was pregnant with a calf at up to 4 months of age, and even though the cow didn't get sick, the calf could be born a PI. So it's, I mean, it's kind of a narrow window to hit, but it is possible. And I think knowing the risks on your farm is what you would talk about with your veterinarian to decide if that was a high risk or a low risk for your herd. Feel free to comment, Blake and Martin, you guys probably deal with a lot more of that than I do.
I don't think I would add anything on to that, Rob. Thank you.
Okay. Do we sometimes create calving wrecks by loving them too much, such as calving in too much cover, feeding under cover, or not kicking them out soon after calving, etc.? So I think by feeding under cover, I think they're talking about body condition.
Yeah, I guess I would agree with that, Barry. I think you bring up a really good point that, yeah, sometimes we do give them a little too much loving. I think I can maybe speak from experience to sort of, my dad definitely was a heavy feeder for sure, and I think it fixes a lot of problems, but I think it also created some calving problems from previous personal experience growing up too as well. And so I think that can be a trouble. Keeping critters in for a little too long, I agree, that comes down to more contamination and exposure, and that's maybe more a talk on scours and stuff too as well. But definitely, you know, our herds that calve earlier in the year and calve through a barn, definitely there's a lot of scours outbreaks that are, you know, born within a barn or in a corral system for sure. And so we see the benefit, you know, of our cow herds out here in the Brooks area that calve a little more extrinsically into out onto the prairie, see a lot fewer issues in terms of calf health, you know, by calving into lower contamination environments and not having to have them into a corral environment or not have them in a barn at all. And so I think, yeah, definitely a little too much babying can cause their own problems for sure.
This is an interesting question. When we go from 3 years of drought to above normal rainfall, can this affect conception rate? Anyone can take a stab at that one?
Probably, yeah. That in ways maybe more than I think we probably could appreciate would be my guess, right? So I think you would hope that, like I was hoping that, so that happened kind of in our area to some degree, right? That, you know, we thought, geez, we finally got rain, we're going to have a heck of a year. And you know what? We're having a pretty average year. And I think that's because the 3 years of drought probably set us up for the fact that we sort of flattened our calving distribution to some degree. So we've had some cows that maybe struggled on in terms of nutrition throughout the year. So they had a tough grass year. Guys didn't pick up their body condition score over winter and over the fall. And then they just came in thin and they just didn't, you know, they didn't get groceries the next year when there was drought yet again. And so then we just got a few more bump off into the second and third cycle. And then even though we got groceries back into them this year, they just didn't have enough time because of postpartum interval and just not enough incline and plane of nutrition to be able to catch back up. And so, yeah, I think it, you know, in theory, yeah, you would expect that, okay, we got good grass here, we should be up and at it. It's helpful, but there's some critters that just maybe just didn't have a chance to catch back up. And it probably also plays into a role on the fetal programming side of things too, maybe more than we can think, right? So that nutritional deprivation during pregnancy could probably affect the expression of genetics of those critters that were sort of stressed too. So, but again, beyond our talk here, maybe even tonight, so.
Have any of you seen calving wrecks due to poor water?
Yeah, I think we have a situation where a farm probably had some ponding of water in an area that had some suspect topsoil brought in, and whether it was some contaminant in the soil that leached into the pond is our suspect, but also just, I mean, some of these areas with runoff water that sits and stagnates could build up huge levels of bacteria and lepto and all that kind of stuff. So pretty hard to say definitively yes, but circumstantially, I think we have seen it.
Okay, there's been a lot of questions about pregnancy rates and open rates. In each of your opinions, what's the top area producers should focus on to improve the percentage of calves weaned per cow exposed? Well, let's start with Martin.
Sorry, I can read this question right now. Can you repeat this, please?
Yeah, sure. What is the top area producers should focus on to improve the percentage of calves weaned per cow exposed? So what can they do to improve their calving rates?
Yeah, I mean, just it starts with the bull selection, I guess, and what we heard before. It starts with the heifers, right? You just want to have your most fertile heifers, and just introducing those into your herd. Plus, the nutrition side of things plays a huge role. And I mean, for sure, the weather needs to be our friend to a certain degree. Just some rain will provide better pasture than the summer. So the groceries are there. That's what I can think of off the bat.
Perfect. Rob, what do you think?
Yeah, I honestly don't have too much more to say about that than what Martin's already brought on. I mean, if you've got good nutrition in a good environment with good bull power, you're going to do fine. So, I mean, that's probably an individual farm question on what is the factor that's causing poor repro rates. I mean, I can only speak in generalities.
Mm-hmm. And Blake, I saw you're nodding your head to that answer as well. Do you have anything else?
Yeah, I agree. And I think that's Cameron's question there that I think I hammered a few things out to. And I wonder if, we're reaching a biological or regional limit in some of those situations too as well, right? So, we see our early calving herds that see, they might see higher death loss because they calve in closer quarters and tighter quarters than that. But they have better reproduction rates because they breed them in better grass conditions, right? As opposed to our later calving herds that, calve in better weather and have, poor, have really good health sort of rates, but they, then are breeding in a time frame when the, nutrition is dipping off. And so I think there's kind of some biology in play there that sort of limits, sort of some of the pluses and minuses, and we still end up around that 85% at some point, right? But again, bell-shaped curve, that there's, some people that are doing things right, and I agree with Rob that each of those situations on how to improve that to get better than that is unique to every single operation. So yeah, I think that kind of requires a detailed sort of discussion for every place.
Excellent. This is another question that could be answered in a similar way, but what is the best vaccination program for bulls? Maybe there's not one model that fits all, but are there some standard vaccinations that you would recommend for bulls?
I think in general, probably the best label claims that exist are with our modified live vaccines, and knowing that bulls are going to be a potential spreader by testicular infections with BVD and other diseases too as well. I think a modified live pre-breeding is hands down probably via label and probably if you talk to any of the pharma companies, going to be one of your best options. And so we still want to target that at 30 days pre-breeding, which is again kind of ballpark when we want to be shooting for our bull breeding soundness or semen tests on those bulls too. So I'd be biased in suggesting a modified live product that's got BVD, IVR, Vibrio and Lepto, and has fetal protection in it as being sort of our go-to on bulls.
Okay, question for Blake. Which would you consider the most important consideration when selecting heifers for breeding? Age of first breeding or weight at first breeding when trying to have heifers calf at 24 months?
Yeah, I think age, right? So you really want to be selecting from heifers that come from your first cycle. have a better chance of having more cycles before they reach exposure to a bull. And there's tons of studies that show that, you know, the more cycles you have before you reach puberty, the better your conception rates are going to be, right? But of course, there's always critters that sort of meet that earlier, right? And I know in the dairy world, they talk a little bit about weight, maybe even hip size and things like that, or size of the critter as to what that maturity level is. But I guess what we don't know about weight is what's the mature cow size of that critter going to be? I guess we don't always know, right? Like I talk about 55 to 60% of their mature body weight, but do we know what the mature body weight of that critter is going to be when they tap out? So that's why I say age is a really important factor. So selecting heifers that I think are from the first cycle can be a pretty key thing to do. And then if you wanted to take it to another level yet, to see if you could include in some critters that maybe be from that second or third cycle, I would say add on heifer palpation, pre-breeding anywhere from sort of 6 to 8 weeks out, being a really valuable tool, because then we can decide, you know, how well are they cycling, what does their reproductive tract feel like, so you can select heifers that are fertile sort of leading up to things, or consider a fixed time AI program that has either a cedar, PRID, or MGA in it, because those can also be, you know, exposing heifers to a progesterone-based product. Pre-breeding in a synchronization program is known to be able to improve or even induce puberty in some critters, particularly with our MGA programs.
Excellent. Anything to add to that?
The other side of that, Blake, too, is maybe size is important from the opposite perspective. If those older heifers are too small, you're excluding them, right? But we have seen a downward pressure on breeding age in dairy because they are growing at a seemingly increasing rate, that they are getting to puberty and adequate size at a younger age all the time. Could be the same in beef. So yeah, you might, based on the maternal body size of that calf, maybe you do include some of the younger ones.
Excellent. I think I will stop there for questions. Just a couple of things before we let everyone go. One is how to get more information and science-based production advice through the BCRC. Go to our website, www.beefresearch.ca, and click the subscribe button to sign up for our free email list. If you've got a Twitter, Facebook, or YouTube account, you can connect with us there at Beef Research. If you enjoyed this webinar, be sure to join us for our next webinar in the new year on meeting your production goals, records for animal health and performance. That'll be on January 13th at 7 p.m. Mountain Time. You'll receive an email from me in a couple of days with a link to watch this recording, as well as links to some additional information on reproductive failure. You'll also receive a link to a survey. If you can take a few minutes of your time to fill out this survey, it's very helpful for us when developing future webinars. So that's it. Thank you to everyone at home for joining us tonight. And on behalf of everyone, thank you, Dr. Balog, Dr. Swackhammer, and Dr. Kaatz for volunteering your time and expertise with us this evening.
Thank you.